Age Tech Innovators.
Hello. Welcome to the Age Tech Innovators, the podcast where we explore how technology is transforming the way we care for our aging population. I'm Monty, your host, and each week we chat with inspiring leaders who are making a real difference in the lives of older adults, sharing innovations and ideas that help support and uplift those who need it most. Join us as we work together to build a brighter, more caring future for everyone. Now, let's dive in. So I have the pleasure to be talking to Steve Gates today. Steve, can you run me through who you are and what you do in 60 seconds?
Okay, thank you, Monty. It's hugely grateful to be here. So Steve Gates, Managing Director, Taking Care. We provide 24/7 monitoring nationwide across both the individual consumer market, 2/3 of our customers are individuals, and across the local authority and housing association market. We, in total, look after about 150,000 people on a 24/7 basis and are part of the move from being a very reactive, call-based service to being much more proactive, preventive, using AI and big data, which I'm sure we'll talk about. Based and live near Exeter, father, 3 children, 2 grandchildren, 1 dog. There we go. Me in total, so and a lovely wife.
Amazing. That's a really lovely overview. And it's amazing to hear that you have grandchildren already. That's super exciting because you don't seem like you do. Okay,
Thank you. They keep us young.
Yeah, my parents are pushing me very hard right now. So before we jump into some of the amazing work you're doing with supporting so many people, 150,000 people is crazy. There's often an interesting story as to how people entered this space. How did you go from doing whatever you were doing before to actually being MD of Taking Care?
So there were 3 things essentially, which I think drove me and interested me in the sort of technology-enabled care market. So I've been part of this organization now for just over 5 years, came in from outside of tech, outside of social care entirely. And there were 3 things. One, I think, is about the sense of purpose that we've got as an industry. And I think we can all recite, the facts and the stats about the fact we're living longer, but not necessarily healthier, that the social care system is in real crisis and it needs some different and alternative solutions to what's been done. So I think age tech can absolutely help in that sort of system space, if you like. The second bit is in terms of the health outcomes that we can deliver for individuals. I can't think of many industries where you are combining technology with some massive health improvements if we get what we do right. So we never ever forget that sort of health benefit. And thirdly, the early and majority part of my career was spent running a subsidiary for AXA Health, which was then sold, and I went with it. And I was phoned up, and they said, "Look, we've got another subsidiary here. It's growing, but we really want to move things forward. How do you fancy leaving Bupa and coming back here to help run another subsidiary?" So from the very big system through the sort of health outcome through to the very practical of actually running a reasonably large organization, but within a really, really big organization.
Appreciate the really detailed overview, step by step. Yeah, we are seeing massive pressures. It's really cool to hear that you were working in health beforehand as well. Was this a conscious decision for the reasons you mentioned about seeing the improvement in outcomes, or did you just land in this space? What was the actual reason you stepped into the market of this industry?
No. The transit. I mean, my entire career has been health anyway. So prior to that, it was dentistry and things like that. So always involved in part of health. And I think this is aged care and age tech is so clearly a massive enabler for the whole of the health system. We all know Lord Darcy, 13% of beds in hospitals are occupied by people who are well enough to leave, but they're waiting for a social care assessment. So I think social care, in its widest sense, is a really, really important part to be playing our part in as well.
So if we look at, you mentioned there are strains on the social care system. What do you see some of the biggest challenges are that we face right now in actually introducing technology at scale, which is what you are currently doing?
So I think there's probably three. Number one challenge is always do what you've always done, and you'll always get what you always got. So we need to start to rethink the way that we provide care and the way we provide technology. I think that's absolutely, absolutely crucial. I'm going to say the digital transition, by which I mean the short-term changes that we're making as an industry to make sure that we're set up for the future. However, I think for us and for me, digital is much more about the wider opportunities this opens up for us to provide support to people in ways that we've never previously been able to, either because we haven't been able to deal with the size of the data or we haven't had the right support around it. But I think the small local digital transition we're going through at the moment, although it appears really, really difficult and really, really a lot of hard work, we mustn't allow that to blind us to the really big benefits that we will get in the coming years, which then means we can develop different services, different offerings for our customers.
Why do you think it is blinding the UK, or at least from what I see, it seems to be such a focal point to the extent that nothing's discussed, and I don't think in many areas nothing will be discussed for 2 years on a significant scale, at least in some parts. Why do you think this is? Why do you think there's such a tunnel vision on this, even though it's been done time and time again in other countries?
And having talked to someone who went through the Australian experience, I'm not sure it's actually that UK specific. That they went through exactly the same. In fact, he was talking to me. They're on there. They've gone through 3G to 4G already, so they've gone analog to digital. They'd gone to 3G. They were now way through 4G. So I think it occupies a lot of time because it's a big change, and because a lot of the things that we know about and have held dear to are about to be thrown away, recast. So if I look at us as an organisation, we look at other organisations, we know the analog telephone system inside out because we spent 30 years testing it and probing it and building the different workarounds we need. And now we're moving to a digital network, which is great and gives us some real opportunities, but it does feel a bit like we are doing some pretty large-scale testing on some pretty life-saving age technology simultaneously while we're introducing a new digital network. And someone described it to me it's a bit like, feels like we're changing the tyres on our car while we're driving along.
Yeah.
And that's why I think there's this real focus on having to relearn some things that we've been really comfortable with, and suddenly have to deal with the fact that mobile phone networks go down. Oh my gosh, how are we going to get around that? Because in the past, if a local exchange went down, it might take out Swindon, but it didn't take out the whole country. So I think we are having to relearn really, really quickly, simultaneously while making this change.
Just want to flag nothing personally against Swindon, of course.
No, absolutely not. Other good cities are available.
So you mentioned that you were chatting to, you said this transition isn't such a UK issue. You've seen other countries go through it. We've had a couple of people on the podcast so far from Malta, from America, from Israel. As MD, how does the approach that other countries are taking in supporting this population group feed into, or how does the information feed into your actual approach, considering that we're supporting fundamentally similar demographics of people living in a similar way?
Yeah. And we do spend a proportion of our time having exactly those similar conversations. And funnily enough, not just about the digital and the technology, but for example, in Israel, they're doing some really interesting stuff about integrating with emergency services and local responder services. And you look at that and you go, wow, is there a UK model equivalent and things like that? Because as I'm sure you are, I'm a huge believer that we don't have a monopoly on good ideas in the UK. And therefore, if we can take what's really good from other parts of the world, we'll have to tweak it and adapt it. We're going to learn that much more quickly. So yeah, absolutely. Some of our conversations are with Scandinavian colleagues who, again, have gone down some of these routes more quickly. Some with other European colleagues as well. Because I think if you can find a good idea, steal it, repurpose it, it's going to move us forward as an industry much better.
One of my mentors says the phrase or the letters R&D stands for rob and duplicate.
Great. Totally agree. Totally agree. If someone has had that good idea first and they've had the courage and the intuition to get out and do that, I think why wouldn't you look on, first movers, early adopters and go, right, is there things here that we can learn from? Totally agree.
In terms of some of the things that you've been seeing around maybe Scandinavia and Israel and the States and just around the world, where do you think some of the biggest opportunities are within the UK for innovation within the next 10, 15 years?
So I think innovation in 10 to 15 years is a really tough question.
Maybe
because I think
5 years.
you know and I know that there'll be things that happen in 10 to 15 years we can't even imagine at the moment. However, yeah. I do genuinely believe that prevention will move from being a subject often talked about but rarely delivered to being an absolutely fundamental part of what the age tech industry can deliver in terms of improvements and outcomes. And I've stolen this from a data security quote because our view is that prevention is a bit like teenage sex. Everyone's talking about it. Everyone thinks everybody else is doing it. So everybody claims they're doing it too, even though no one's actually doing it. And I think we will move.
Sorry, go for it. I was going to say it sounds representative of my childhood.
No, all our childhood. And I think that's our challenge. If I had £1 for every time prevention is mentioned at one of our webinars, conferences, podcasts, and things like that, I'd be on a beach in the Bahamas. However, when you unpick underneath and go, right, are we using technology in a really intelligent way to get ahead of the curve, then that's genuinely where I think we will see the really big changes next 5 years.
So right now, lots of people are talking about prevention. There's some products and services which back up this talking. And I'm not in no sense in trying to plug your career, really emphasizing that. Where do you see that organizations are bridging the talking about actually doing it? And how do you see that they're doing this, even in small scale, in terms of using prevention successfully?
Yeah, and this is where, because taking care primarily occupy the individual and consumer space, I think we can move much more quickly because we can move at the speed that the consumer demands, thereby building up the evidence which will allow us to demonstrate to commissioners, to local authorities, that this can have a massive impact. So some of the areas that I can see organizations such as ourselves are moving is in terms of how we use consumer tech like Fitbits to draw off individual data about health, and how we then use machine learning to predict the likelihood of a fall, and the ability to take a massive amount of data from a large number of people, but to prioritize those that we absolutely should be talking to. I think that will make a massive difference. Where you've got devices that use machine learning to understand how you move around the house, or how often you come into the kitchen and how often you stay there, and that develops the ability for us to pick up changes in that behavior. Again, I think those are really, really important, because some of this is where I don't think we will ever take over the need for human to human interaction. However, I think for organizations to be able to prioritize who they really need to look after, and to make sure their human resources and their medical resources are devoted to those people, will mean that they can have the biggest impact. And that's where, I think we will move to a point. We hold a lot of individual medical level data for our customers. So the medications they're on and things like that, I'm hoping we'll get to a point whereby we can run some machine learning on top of that to go, look, highlight to us those customers who are on a combination of medication that's likely to lead them to an increased likelihood of falling, and then let's reach out to them. Because I can almost guarantee that their local doctor, their GP, doesn't have the bandwidth or the capability to say, I'm now prescribing Steve a fourth medication, and because he's on those three, that fourth one is going to have a really big impact. But that's where I think things like machine learning and AI and big data will start to tell us stuff that at the moment, really, really difficult to get hold of and use.
So you mentioned a really interesting point about how you hold information about your customers securely, of course, which is health data. And you also have the potential to take on some of the additional data sources like Fitbits and Apple Watches to feed into this.
Yeah.
When I was in the States, I was in DC last week at similar to what the TSA is, but in the States called MAMA. You might have heard of MAMA. And their PERS industry, which is their telecare industry, so personal emergency response systems industry, just to people who don't know what PERS is. Their PERS industry ties really closely to the insurance industry, to Medicare. So some of the savings that you create are actually reflected, and therefore the insurance company will pay in some cases for those devices. We don't see this at all in the UK because of the separation in the healthcare industry. But you're in an interesting position because you are also working somewhat more on the health side and insurance side, or at least this is what I see from the outside. Can you share some thoughts on this?
We spoke to an American organization that was doing some amazing things in the space of what you and I and we over here would call a virtual ward. The ability to take someone who they claim to be able to take them up to intensive care level, to get them home with the right monitoring devices, and then they would have a doctor doing the rounds in the car, and the AI would be directing the doctor as to which patients they needed to visit. We went, whoa, you're like light years ahead. And they said, well, we are, but that's because the American medical system pays us 50% of what it pays a hospital to look after a customer. So you are absolutely right. There is a massive financial incentive in the American healthcare system that simply doesn't exist in the UK. And that's where I can see in the medium term private healthcare providers, the likes of the Boopers and the AXA Health and the Vitalities, starting to think about this in a different way and possibly quicker than the NHS, because I think we all know, regardless of what is said, there's still a lot of siloed funding. And I think the American system has allowed them to open up some innovation by being really clear that we will fund this, and we will make sure that those people that are taking people out of hospital are appropriately rewarded. Don't see that in the UK yet.
Is this something which you mentioned that? So there's the insurance side, then there's your B2C market. Is this an ecosystem, as you mentioned, starting to become formed, where some of the information that you can gather and predict from these users will feed into the actual savings on this side? So it's almost like it's a boiled down version of what's happening in the States.
So we are trying that at the moment with our parent company AXA Health. They clearly pay for a lot of people to have hip operations, knee operations, ankle operations, and we've got a little pilot with them to say, let us provide the remote monitoring. So almost when they come out of their operation, there's a little box which says, take me home. I'm a watch which looks like a Fitbit, so I'm not stigmatizing in any way. And if at any point when I'm going through my recovery, either I fall, and because I've just had a hip operation, it's likely to be more impactful, or simply I need to talk to someone. So that, if you like, is a really, really small example of where we're trying to say in that consumer space, are there things that we would traditionally deploy for older, vulnerable adults? But you can imagine a 55-year-old who's just had a hip operation has probably never felt as vulnerable as immediately after that hip operation. And therefore, I think there are things that we can definitely do.
Could you share, if possible, if not, no issues, but could you share more information about this pilot? Just because I think one of the biggest barriers to the UK innovating at the pace that I feel like it could innovate is because of this lack of incentive towards innovation and the separation between the actual outcomes and the benefits and then how people are remunerated. And so this, for example, this pilot you mentioned would be a key piece of evidence as to why we need to change.
And I think when we've been able to do this at scale and collect the data, we absolutely will do. So I'll use a slightly parallel example to this in terms of prevention with some of the work we did with Innovate UK and Ulster University and Age Northern Ireland over in Northern Ireland, whereby we were able to demonstrate that by using wearable technology, by using AI and big data, we could, I'm going to use the word massively improve. Ulster University said clinically significantly improve things like people's confidence in both staying at home, keeping mobile as well. And I think as an industry, we are going to need to go through the conversation with Department of Health and Social Care, with the commissioners, which takes those very people-centric benefits and translates that into language that commissioners can understand. Because I think everyone quite often nods and goes, yeah, I can understand the benefits of an individual feeling safer and more confident. But as a local authority commissioner, with all the other pressures, do I care about that enough to put the funding? And I think as an industry, we've got a level up that we need to move at scale to go, and these are the system benefits that we would expect to see as a result of that.
So I went to a meetup with about 25 suppliers of the tech industry, and the overall agreement was that until this changes, or that this is the highest leverage task that once changed, then it would drive innovation in every other way. It's not more case studies on an individual company to company basis. It's that structure about how people are incentivized.
I think we need, as a group, to be able to demonstrate really clearly, but because we all know that social care funding is not increasing dramatically over the next 10 years. So, someone described it to me from a commissioner's point of view. The question we're asking ourselves is, how do we cope with double the demand with half of the funding? Because that's what we can see happening in the next 10 years. And I think that's where age tech, technology-enabled care needs to be part of the dialogue to say, we are part of the solution. We will help you with the clever things that we can do and the big data analysis. We will help you prioritize your funding to those people who need it most, which means you'll be able to look after lots more people because you won't be trying to support each one of them on the same basis. You'll be able to have your key people there that you need to provide a lot of support, and you'll have your medium group and you'll have your low level of support. But we're using technology to identify how individuals are moving between those groups. I agree. It's a massive conversation to have.
Let's say someone's 55 and they just leave hospital and they've had an operation. Giving them some level of technology to help them feel more independent is remote monitoring, but not so much age tech. It's just general health.
Yeah, agree.
From what I've been chatting to others about, we see there's a gradual progression of not so much age tech being towards the elderly people. It's just tech that is doing remote monitoring. Is this something you're seeing as well? It's more of a diversification of who's being supported.
Yeah. And I think that is happening as we widen out the number of things that we do. I think if you look, a lot of historic technology-enabled care has been very reactive, and it's been around pendants and alarm boxes, and that inevitably limits you to a certain age category. I think as we start to think about how we can use someone's health data, we start to massively expand. And you're right, it ceases to become age tech or end of home tech, and it starts to be, actually, it's just how I monitor my own well-being.
Which is so interesting, because there's this idea that the population, or not even an idea, we're seeing the population of elderly people doubling by 2050. And so there's this idea that this industry is going to massively grow. But it's going to massively grow exponentially, because it's not just supporting those individuals who are growing, it's supporting just the general growing population of people who need support.
Yeah. And we know the population's gonna double, as you said, but they're not necessarily living healthier lives for longer. There are some real vulnerabilities that people will be living with for a long while, and therefore I think how you help them either prevent those issues or how you help them live. We talk about, as an industry, the gloriously ordinary lives that people want to lead. I think it's a massive challenge and opportunity.
Yeah, I think that's underappreciated. People are always trying to live in an incredibly optimized way, but just staying healthy for longer it's something that can be achieved.
Yeah. I don't think anybody wants to live an extra 5 years longer if it is 4 years in really, really poor health and challenging circumstances. So how can we make sure that those extra 5 years are lived in the best way possible?
100%. Well, Steve, I'm a bit sad because this 30 minutes has gone so fast. My last question is, for anyone who's listening who's considering entering into this space, either bringing their own innovations or looking to work at businesses like yourselves, what encouraging advice would you offer listeners considering this?
I would say just do it. Just do it. I think I can imagine as a entrepreneur or tech entrepreneur, you wouldn't necessarily say social care. That's where I want to be. However, I think the impact that you will be able to make is so clear and so visible and so immediate. And we are a market, we are a group of people that are just crying out for disruptive innovation. I'd say just do it.
Amazing. Well, Steve, thank you so much for your time. I really, really appreciate it. And I look forward to chatting soon.
Thank you, Monty. Much appreciated.
Catch you. Bye, 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 bye.